Hullo YouTube. Welcome to Dr. Vibes, a learning point. In this video, we shall study the viva questions asked on edema. What is edema?
Edema is the accumulation of excess tissue fluid in the interstitial space or the interstitium. What are the types of edema with examples? There are two types of edema: pitting edema, non-pitting edema. Pitting edema is due to congestive heart failure or cirrhosis of liver or due to some renal causes like nephrotic syndrome or chronic kidney disease. But non-pitting edema is due to mixed edema or mixed edema goiter or lymphatic obstruction as in filariasis. What are the causes with examples? Now you can divide the causes into two groups. One is localized causes and one is generalized or systemic causes. Localized causes of edema can be cellulitis, can be traumatic hematoma, can be localized infection, or it can be deep vein thrombosis. But systemic causes, you can divide it into cardiac causes like, as I said you, congestive cardiac failure, constructive pericarditis. It can be renal causes like nephrotic syndrome and chronic kidney disease. It can be liver causes like cirrhosis of liver, and it can also be due to malnutrition like protein allergy malnutrition. Where to see for edema? You have to see it on the medial malleolus, then you have to see it 2 to 3 centimeters above the medial malleolus. You can also see it on the anterior part of the shin bone on all these sides for 15 to 20 seconds. Now, if the person is on bed, then you have to see it on the dependent portion of the body, that is sacral edema. What is the mechanism of edema in congestive heart failure? What happens in congestive heart failure? Heart is not able to pump adequate amount of blood. Okay, so the renal blood flow is diminished. This diminished renal blood flow will cause RAS system to activate. This will cause release of aldosterone, that is secondary hyperaldosteronism, which will cause edema. Causes of facial edema, there can be 3 causes of facial edema. One is nephrotic syndrome, one is congestive heart failure, and then it can be also due to cirrhosis of liver. Now in nephrotic syndrome, the first of all edema occurs in the periorbital region, and then it goes to the legs and then to the abdomen, that is ascitic condition. In cirrhosis of liver, it starts from the abdomen, that is ascitic condition, then it can go to the legs and then face. And finally in congestive heart failure, it starts from the leg and then goes to the face and then lastly to the abdomen. Drugs which can cause pedal edema. This is your homework. You will answer this in the comments and Differentiate between renal and cardiac edema. As I told you, renal, periorbital first, then legs and then abdomen. Cardiac is first leg, then facial and then abdomen. Another difference is renal edema you will see in the morning when the patient gets up in the morning. Cardiac edema is seen towards the end of the day. I have already discussed the local and generalized causes of edema in example number 3. Now, causes of unilateral pedal edema can be due to cellulitis, deep vein thrombosis, traumatic hematoma. Now, anacerca and generalized body swelling. Generalized body swelling is when the edema is present in the 2 non-contiguous portions of the body. And anacerca is the generalized body swelling plus the accumulation of the fluid in the 3 serous cavities of the body, either peritoneum, either pleura or pericardium.